We're in the height of sports season and the season where your body could get extra achy with the cold. Joining us today is Dr. Sean Halliman, a sports medicine surgeon with Proliance Orthopedic Associates. Thank you for being here.
Thank you for having me.
So what is sports medicine and who do you care for?
Yeah, sports medicine is really the diagnosis and treatment of movement and activity related problems with joints, muscles, and tendons. And so I think traditionally we probably think of sports medicine like the young competitive athlete that gets
That's what I was thinking.
Yeah, you get injured on the court or the field, you go in and you get treated. But in reality, the majority of what we see are everyday people that love yoga or pickleball or golf, or maybe it's just cooking and cleaning and gardening, but joints will start to hurt, muscles and tendons will get injured, whether acutely or chronically, and that's who we take care of.
Okay, and what led you to really focus and hone in on the shoulder too?
Yeah, I just love the shoulder as a joint. It's a very it's a very complex joint. It's the joint with the most motion in the body, so there's this beautiful balance between the stability of the joint, the mobility, the strength, and then the dexterity. And in any complex situation or system, it's prone to have problems and injuries, and the shoulder is one of those. It is prone to injury, and those injuries are debilitating. So people have severe pain, and what's kind of unique about the shoulders, they have a lot of trouble sleeping at nighttime, and that brings a lot of people in.
Yeah, that makes sense. So what kind of injury specifically do you see with the shoulder? I guess we'll start there.
Yeah, well, I wanted to create an environment where anything that could go wrong with the shoulder, people could come into my clinic and be seen for it. And so we see the whole gamut of shoulder problems. So younger generations tend to have more shoulder dislocations or instability, so labral tears or ligament injuries that we can fix through arthroscopic techniques. As we get older, we start to see more rotator cuff tendon injuries. That's a pretty common phrase that people know about. Yes. And those ones are very painful, and again, we can use arthroscopic techniques to fix those. And then as people get older, unfortunately, we see more falls and fractures and then degenerative changes like arthritis.
Gosh, yeah, and I want to talk about that as we're heading into this colder weather. We're really here now. Joint pain, arthritis, the flare-ups you're talking about. So what does that mean really for treatment with something like that?
Yeah, arthritis, much like hip and knee arthritis, is really just a breakdown of cartilage. So the shoulder will get stiff, it'll become painful, it'll become weak because of the pain. And so we see people come in, we can get imaging on site at any of our clinic locations. We can see if a joint's starting to get arthritic. And traditionally, we'll try to start with conservative treatment. So movement, physical therapy, maybe medications or injections, which can be really helpful. And then ultimately, if none of those things are really providing people with relief, then we can do surgery.
I know, I want to talk more about surgery. What does that look like? Because I know it can be intimidating for some people. And at what point do you call and say, okay, this is when I need to go in?
Yeah, I think when you come in is really when it's affecting your daily life or your sleep. So on a daily basis, if you're having pain and some of these standard conservative treatments are no longer working, then surgery can be an option. And much like the hip and the knee, we can replace the shoulder. So what's unique about the shoulder is that we have a couple different types of shoulder replacements. So we can do what we call an anatomic shoulder replacement, which means we try to mimic normal anatomy and just replace those components so it moves smoothly and you get your strength and your motion back. But there's also a reverse shoulder replacement.
What does that look like?
So essentially you just change where the ball and the socket are in the arm, and it changes the geometry of the shoulder. And that's more for people that have rotator cuff problems in addition to arthritis, because the shoulder needs a rotator cuff to function. But if we can switch the geometry, we can get a good functioning shoulder without having to have a rotator cuff. And sometimes we use it for people with poor bone quality or bad fractures as well.
Does it kind of depend on the injury too, how long, rehab and everything looks like after?
Yeah, absolutely. Some of the more severe injuries, the fractures and stuff, will take a little bit longer. Some of the standard arthritis, we can get people moving a little bit quicker. And what's really neat right now with technology is we have 3D software where we can map out the shoulder before we even do surgery to make sure the components are in the right position. We're starting to use stemless implants so we can preserve bone stock and reduce blood loss in surgery. And then coming in 2026, which I'm really excited about, is we're going to do tendon sparing shoulder replacements. So traditionally in a shoulder replacement, you have to cut the front rotator cuff tendon, then you have to repair it at the end. So if we repair something, we got to protect it. So that means 4 to 6 weeks in a sling. We limit motion, we limit activities. But when we do it by keeping the tendon attached the whole time, we'll be able to reduce all of that significantly.
This is mind-blowing, and it's happening in 2026. I can't believe it. How can people find you? How can we find more information, too, if we're sitting at home right now and we're like, ooh, it might be time?
Yeah. Well, we're with Proliance Orthopedic Associates, so we have 6 clinic locations, all South King County area, from Renton all the way down to Maple Valley and Lakeland Hills. We have 2 urgent cares, so if you fall, you have an acute injury, you feel like you broke something or tore something, we have 2 clinics you can go in, be seen the same day, and get imaging and on the right treatment path. And then, if it's just a nagging, lagging kind of injury that you just haven't dealt with yet, any of those 6 clinic locations, we try to get people in quickly. We have x-ray on site everywhere. We have a cast room. We have access to an MRI, and we have our own PT that we just started. And then if you need surgery, we have a surgery center. So you can have surgery, even a shoulder replacement, and go home the same day.
Wow.
And sleep in your own bed.
One-stop shop. Thank you so much, Doctor. We really appreciate it. We know you're busy. And for more information about how to find Dr. Holloman, just visit the website that you see right there on your screen.
New Day Northwest is sponsored by Proliance Orthopedic Associates.